Hi, this is Dr. Sharon Saline, and I'm here with Tuesday Tips at 2. And today we're going to talk about self-care in the age of doing too much. And this is certainly going to be a talk for myself, as well as for those of you who are tuning in. I'm home with a very bad cold and had to cancel my trip to California this week, which is a bummer. And I'm sure it's because I'm doing too much. So I thought, given that we talked last week about time management, this would be a good opportunity to really reflect a little bit about self-care. So when we do too much, it's usually because we have trouble prioritizing what's most important, what's urgent, and what we can let go of. It's hard, as we know, to sort of maneuver around the urgent and important matrix. What's urgent, what's important, what's not urgent, what's not important. And we're a society of doers, not beers. And for people with ADHD, they're on both extremes. They can be on the extreme of doing a lot of things simultaneously, or the other extreme of spending hours kind of losing track of time, surfing the net, spacing out. So how do we manage to take care of ourselves? You know, for me, I tend to think I can do more than I can in a given amount of time. And I sometimes rush around and squeeze too much in. And that's kind of what makes me very productive, but it also can make me sick. And I think that many of us lose track of really taking some time to assess what we're doing, how much we're doing, where we can stop. For people with ADHD who have trouble with prioritizing and planning, that can be especially challenging. So I'm going to give you 3 steps towards self-care that I found really helpful with my clients and also when I apply it to myself. The first step of self-care is really slowing down or stopping your activities or your distractions long enough to connect with yourself. Is what you're doing what you want to be doing, what you should be doing? We call this the stop phase. The second phase is the think phase. Think about your choices. What would help you get off your hamster wheel? What would help you get back to what you need to be doing? Who could help you with that? Is there a friend you could talk to? Is there a list you could make? Is there someone who can help you set up a plan for yourself? Do you need a timer? If you're doing too much, do you need to stop and take a bath or have a cup of tea or take a walk? It can be really hard to stop yourself. And I think the thing that can help you really kind of slow down and do that pause is to notice what's happening in your body. Are you racing around? Do you feel a lot of adrenaline surging? Do you feel off balance? Then you can think about what's contributing to that. The final step is action. What are you going to do to nurture yourself, to reorient yourself, to change what you're doing in the moment so that you can feel better, and maybe to think about how you want to change to doing things in the bigger picture. So the entire part of this plan, the entire name of this plan, is Stop, Think, Act. And I'm going to come back to this at different times because I think it really applies to many things in life, particularly those big emotional overwhelms that all of us have and particularly are challenging for people with ADHD to maneuver. But today we're thinking about Stop, Think, and Act in terms of self-care and managing your ability to really reassess where you are and what you're doing. I hope this was helpful for you. I encourage you to like my Facebook page. I'm sure you already have if you're tuned into this. But what I really would love you to do is to go to my website and check out the other videos and handouts and blogs and sign up for my newsletter to stay connected. I hope you have a good day. Thanks a lot. Bye-bye.